The problem with his placement was, there really wasn't, from our view, any problem with his placement, and certainly not from his view, but the foster parents and the Child, Youth and Family Services, they disagreed over issues pertaining to his care, but there were no issues identified that would have related to the safety of this boy in that placement. He had a sister, a sibling that was in care, and the social worker arrived at his foster home under the pretext of taking him to McDonald's for a visit with his sister, and instead they took him to Child, Youth and Family Services. There they informed him that he wasn't going home that day. He was moving immediately to a new foster home, and which involved a change of schools and loss of friends. They told him his belongings would be packed up and delivered to this later. Wide deficiencies, and those would relate to the shortage of caregiver homes and caregivers, of course, and social workers in the in-care program, both in terms of positions as well as the number of positions that are vacant where there hasn't been successful recruitment to fill them. The lack of training for caregivers in the system to help them deal with issues of grief and loss and attachment for children and youth in their care. That's essential. And also there needs to be a development of the role that caregivers play as part of a team that supports children and youth in care. That was identified for us by the caregivers, and also from our own interviews with social workers as well, that this is something that really needs practice-related developments can really be broken down into three main areas. One deals with the fact that essential documentation in the files was missing or incomplete in what I've termed a staggering percentage of the files that we reviewed. And the reason that this is so significant is because if you look at it in terms of the turnover of social workers, coupled with inadequate file notation of how often they're visiting children and what they're identifying as their needs, how often they're visiting with the caregivers and what they're identifying as needs, that taken together by inadequate file documentation results in a complete lack of continuity of care for children and youth. And in fact, that was a factor in close to 1/3 of the files that we reviewed.